Good morning and welcome to Black Mental Health Matters. Today our topic is on how can mental health workers and professionals increase health equity to improve our community's mental health. Joining me today is Dr. Cynthia Williams. She's a substance abuse specialist and I'm going to let her tell you a bit more about herself. Welcome, Dr. Cynthia Williams. Good morning. How are you? I think we're having a little technical difficulty here, so just bear with us. Good morning, Dr. Williams. Can you share with our audience a bit more about your profession? Just introduce yourself to the audience. Well, today, Cynthia, I'm not hearing you. No, I can't. I'm not hearing you. I'm not sure that the audience is hearing you. To all our viewers out there, just bear with us. We are having a technical moment and we'll try and resolve it as soon as possible. In the meantime, what I will do is share with you this comes from the Center for Disease Control and Prevention. This is an article that was written on their website on July 12, 2022. And it says, and I quote, mental health care is important for mental well-being, yet many people from racial and ethnic minority groups face obstacles in accessing needed care. These obstacles may include lack of insufficient health insurance, lack of racial and ethnic diversity among mental health care providers, lack of culturally competent providers, financial strain and stigma. And these are basically some of the areas that we will be covering today in our conversation as soon as Dr. Williams can get her mic going. Dr. Williams, let me know when you're ready, but in the meantime, I'll continue to share a little bit more on. You're ready? It seems as though we have Dr. Williams on audio. Awesome. Okay. So I was asking you to introduce yourself to the audience so that they know a bit more about what you do professionally.
Microphone.
So in the meantime,
Yeah. Hang on.
So in the meantime, while I'm trying to clear the technical difficulties, I'll go on and share a bit more from Centers for Disease Control and Prevention. And this segment actually talks about how racism negatively impacts mental health. And racism contributes to unequal access to resources and services, including mental health care. First-hand experiences of racial discrimination, as well as witnessing or hearing about discrimination from others or in the media, can cause or intensify stress and racial trauma. Mental health equity is a state in which everyone has a fair and just opportunity to reach the highest level of mental health and emotional well-being. And as I said earlier, that comes from the Centers for Disease Control and Prevention website, article on mental health equity. So one of the things that I wanted to discuss today was the idea of what an ideal system of delivering mental health care in communities would look like. And I know for many people, especially people in the Caribbean, that mental health is still pretty much a stigma. We're still grappling with how do you take your loved ones into a mental institution and return them to wholeness without having, especially if you're in a village setting, people point their fingers at you and think, that mental health means that that's the end of life for you. But I will go on to say that there are many people who have suffered from mental health issues who are still functioning in professional capacities, who have recognized there's something wrong and got the help that they needed. And one of the things that came out of my research is that if you are financially able, it is easier for you to access mental health care. It is easier for you to take a holiday even and seek the care that you need away from the prying eyes of nosy neighbors. You can simply say to someone, I was in Switzerland for a couple of months doing something. And no one would know that you were actually in a mental health institution. And that's the benefit of having financial stability and dealing with mental health issues. And we can ask ourselves, is that fair? Is that a fair and just system where one segment of your community can easily access care because of their financial position, or in some cases, their status in society? Mental health affects everyone in a society. Everyone. And I'm of the opinion that everyone should have access to mental health clinics. I am not 100% sure how many mental health clinics we have here in Barbados, but I know that the polyclinics do have psychologists or psychiatrists, so to speak. But how many people are willing to get up and say, you know what, there's something wrong with me. My behavior pattern has changed. I'm no longer doing the things that I used to do. And therefore, I need to seek help. Therefore, I need to go to a place where I can feel safe and discuss what is going on with me and get the necessary treatment. And these are some of the issues that we face when we're talking about mental health equity. Can everyone afford and access mental health care? One of the other things that I wanted to discuss, that we were going to discuss, we are discussing, is the overall family unit. How does that impact? Should there be care for the overall family unit? Should everyone in the family be given access to mental health care? I know for me personally, growing up with a cousin who was severely affected by mental health issues, as a little girl, that really took an effect on me, and my other cousins, watching her go from calm to not being calm, to being violent in some cases. And for me, growing up with the fear that that could happen to me, that could happen to my children, because there's that belief that maybe this is something that is carried from one generation to the next through DNA, through the genes. And I must say that I'm very, and I stand corrected because I'm not 100% sure on this, but to date, I don't think that I have had any issues with my own mental health to the extent where I had to be institutionalized. But I know that for me, if things are not feeling right, I have my Centers for Spiritual Living community that I can turn to at any given point. And it's a big community. There are lots of people I can call on to discuss what's going on with me and get back to that place of relative wholeness, that place of feeling better, that place of identifying what's going on with me. And I think that when we talk about equity in mental health, we have to look at the support systems that we have within our community. Who's going to step up to the plate and say, okay, Sonia, I've got your back today. I understand that you're going through these challenges and that they are weighing you down, but I've got your back. And I think that equity does not necessarily, well, let me start correctly. I think that mental health care is a community care, in that everyone within the community should come to that place where they say, look, I've got your back. I've got you. And just take care of each other. I think that is important. That mental health care is not just about the professionals and the caregivers, but it is also the family. How are family members doing? Are we doing okay when one of our own has an issue? Are we stepping up and saying, you know what, this can impact me, so let me get help, let me get the education that is necessary so that I can deal with this issue? I think these are the things that we need to look at, rather than look at mental health in a vacuum, but look at it, how does this impact the immediate family and the wider community? I think we have Cynthia back. Cynthia, are you ready?
Hello,
Cynthia, are you ready? Oh, yeah. Welcome back, Cynthia.
Oh, I do so apologize. I mean, I couldn't get into my phone at all. So I do apologize. Can you hear me and everything? Can you hear me?
Yes, I can hear you and I can see you.
Wonderful.
Yes.
Okay. I'm just listening to some of the things that you're saying, and there is a fear, there's a stigma especially in families that, you know, one person has a mental illness, and that scares them, and either they kind of try to not talk about it thinking that it's going to go away, or it's that family secret that no one, well, yeah, oh yeah, that's just Uncle Joe, he's okay, he's just this, that, or the other. And within our own families there can be that stigma, and that could stop them, our communities, from having equitable mental health care, because we don't want to take them, and it's a family thing. We don't want to talk about that. That's family.
That's correct. I
But
think one of the things coming out of mental health too is that families can feel ashamed of having relatives who are not doing well mentally.
absolutely, absolutely. And I think what needs to happen is that we need to have more mental health professionals that are uh, in the African American community, that actually look like us. Because what I've found in my work is that there's an eagerness to get help, but they want it from someone that looks like them.
That's correct. I've heard those stories coming out of Canada as well.
Uh, and in my work with
So,
children,
how do we, as mental health care professionals, level that playing field where there's equity? How do we make it equitable for persons who are in the lower income brackets to access mental health care?
I think we have a responsibility to get out there and let our faces be seen. Let them know that help is available, that there is no shame in it, and if they need the help, it's available. I know that that's a tall order for us to kind of do, but there's a hesitancy to seek the help if I don't want to go and talk to someone else if they don't understand what I'm going through. So I think we have to make ourselves more accessible. There's got to be more community uh, community events where they can at least see, oh, they actually have someone there that has gone through something similar to me. Oh, maybe I will take my child, or maybe I will take my parent to go see them.
So, if I'm hearing you correctly, you're saying that having a presence, a person who's dealing with the mental health issues in Black communities is very important because we want to be able to have people who, one, understand our ethnicity, understand our culture, maybe our religious backgrounds, someone who can identify with us in the areas that really matter. Is that what you're saying? Am I hearing you correctly?
We have to make a presence. It's we we have to. It has to be shown in those communities that yes, there is help available. Granted, as I say, it's going to be a tall order because we don't have many. I mean, we need to get more that are interested in the behavioral health field to go through it. But we need to make our presence shown in these underrepresented communities, in the Black communities. They've got to see us out there, and it's no shame in going and getting help.
I agree with you that there's no shame in getting the help that you need. And that brings me to this question
Okay.
because very often the first contact with a person who's having a mental health issue may be with the general medical practitioner.
Mm.
Should our GPs be encouraged to check for mental health issues? And I'm saying this from the perspective where I believe that there's always that mind body connection to any disease. Do you think that GPs should be encouraged to check for mental health issues when someone comes to them who's not feeling well, to see if there's a psychosomatic issue going on, I'm not feeling well because I'm stressed or something is bothering me.
Slowly, I'm beginning to see that the GPs are actually starting to ask those relevant questions. I recall the last visit I had with my GP, they actually did ask those questions. And that's been a long time coming. I absolutely think that that first line of defense is going to be with the GP, and they can ask those questions. Uh, in integrated health, where I currently work, we do work with people, and we work on that physical, mental, and emotional. It has to be that 360 health, and we're getting there slowly. But integrated health is the direction that we need to be going here at in this country, in this community. It has to be, the buck has to stop at that GP, because then it's that GP that, if they ask those relevant questions, then they can kind of steer them in the direction of, well, in the behavior health direction.
You mentioned the word behavior, and I know that very often people suffering from mental health challenges are misdiagnosed
Mhm.
as just having a bout of, bad behavior, some sort of behavior problem going on. And you can see this especially in the elderly or the very young. How can we change this so that access to mental health care is given sooner rather than ignoring the issues?
And sadly, that is so true. We do, they are misdiagnosed. Oh, they're just getting, they're getting old, or they're, how can we, it has to stop with, again, it has to start with the GP. It has to start with the individuals that work in these health professions. They have to be more cognitive of not just pigeonholing individuals. You're just feeling like
When
this.
you
No,
pigeonholing, what do you mean?
they've got to ask more questions. It can not be just two or three questions. Oh, this is what, you feeling this way. Oh, you're just a little depressed today. You'll be okay. No, it has to be more in-depth questions, and it has to be more than just 15 minutes in a GP's office. You're not going to make a determination of someone's mental or well-being in asking 4 or 5 questions. And sometimes they're not going to be very upfront and honest with you anyway, especially if it's someone that does not look like you. And then you start asking some of those in-depth questions, they're going to say, whoa, 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 what do you, I'm not going to answer those questions. They may not even be comfortable talking to you at that point. Our health professionals are on that front line. They've got to be more perceptive of the individuals that come into their office. And if they see that they're not comfortable talking about certain questions, they need to be able to hand them off to someone that maybe they might be more comfortable with talking to. Or maybe if it's an elderly person, they need to be, hey, are you more comfortable having your daughter or your family member in here when we're talking to them? It's perception. They need to be not, okay, 15 minutes, we're done. Next 15 minutes, we're done. That's what I think needs to take place.
I'm going to ask this question because it is one of those questions that really burns me a lot. And I find that sometimes in the healthcare profession that we're calculating the dollars rather than the care of the person before us. And I know I've heard of cases where people have gone to therapists and it's always come back, there's never a door that is open where they can stop going. It always seems as though they've been going to the same therapist year after year, a year after year for the same issue. Are some of us as mental health care professionals keeping our clients, patients tied to us for the economic benefit to us rather than the care that we can give to the client? And I'm asking this because we're talking about equity. And I think equity goes both ways, not just for the person who has a mental health issue, but the person who's saying, well, you have an issue, I'm going to take as much from you as I can. I'm not going to assume that everyone plays by the same ethical rules when it comes to business.
Well, and you're absolutely correct. Some of them do not play by the rules, and that's a sad thing. I've also had situations, unfortunately, currently where I work at, it's when therapists are a very is limited commodity. So when they are assigned to a client, there's 12 sessions and then they're done. And I'm frustrated in that sense that especially with a young adult or a child, 12 sessions, there's no way that you're going to make a difference, especially when you're trying to establish trust, which may take several sessions. And then here is 12, the 12th session, and then, okay, well, let's see where have we made any progress? Oh, we haven't. Well, okay, we're done. Or then they got to reinvestigate whether they can do. On the other hand, yes, I've seen where in the private sector, yes, they have kept an individual for 2-3 years. Have they made any progress? If they haven't made any progress, then why are you still keeping this individual? That's not fair that's not ethical for that patient that has come to you seeking help. So there is an inbound. How do we
Yes,
change that?
is.
I
Well,
mean,
that's a question, and I think that's a question for another discussion where we as healthcare professionals have to get together, have a forum where we discuss the way forward in terms of making it possible for all persons to have access to healthcare,
absolutely.
even if they're in the low social economic bracket. How are we going to do that? Are we going to ask for governments to have more funding for healthcare?
Especially in behavioral health, especially with counseling therapy. It's very difficult at times to get the funding for that, and with insurance, there many times there's a set amount of sessions that they are willing to pay for, which is not fair.
I understand that it is not fair, but I think that coming out of COVID-19, the world has its eyes now on mental health care in a different way. I think that we're realizing that our emotional and mental well-being is very important in order for the society to be productive. So I think that governments are ready to put their hands deep down into the little pockets and say, look, we're going to spend more money here. But are we willing to work with that? Because it might mean that if government is going to subsidize healthcare programs, that we as healthcare professionals may have to revisit what we're charging per hour.
With that being the
We may have to say, look, if we're going to have to subsidize, we can charge less, or we can do a give back where we give a certain amount of hours per month to a health clinic, volunteering at a health clinic to help out with the situation in terms of making sure that people can get that assistance that they need.
Well, I will tell you from where I'm sitting, I would have no problem with doing some volunteer work in a health clinic, providing counseling, because the list has been long in people waiting just to get assistance. I think COVID has shown many of us, there's many that have been talked about how depressed that they have been, how more anxious they are, especially our children. So if the government is willing to dig deep, as you say, I know that I'm willing to do my part. I'm just speaking for myself. I don't know how others would feel, but right now we therapists are at a minimum. We are not. They're not coming into nonprofit and staying for long periods of time. They get their license and then they go off to the private sector because that's where the money's at. But if the government is willing to subsidize in some degree, maybe we might be able to keep some of those therapists in nonprofit.
This brings me to the question of, should we teach mental health at the general school level as part of our general curriculum? And if we are doing that, what age should we start? I mean, we have sex education and religious education as part of our social studies. Should we make mental health a part of our social studies within the school system?
I think it's sorely missing. I think this is something that needs to be addressed. It's going to be That's a sensitive area. I mean, just like with any of the others ones that you just mentioned, it's an issue that that family members are going to probably be up in arms about. But I think I think we're seeing more and more cases of, again, the anxiety, the depression in our youth, the cases of suicide, the substance abuse just to numb the pain. I think families are might be more receptive to it now, at least talking about it. So I would like to see it talked about a little bit more in schools. I know we're
I just
currently
think
run.
that if young people start young, you can go ahead.
Oh, I was just saying that currently where I employed, we do school outreach where we do go into schools and run like group sessions about coping with depression and coping with anxiety. So it is needed.
I just think that if you work with young people and you start programs like mindfulness in the school and yoga, things that help them to de-stress and connect to themselves in a different way, I think that would help. I always think that if you can change what is going on at the seed level, the tree that grows from that seed would be a different kind of tree. That's just my opinion. And I'm also a believer that mental health is connected also to your spiritual well-being. I am a licensed spiritual practitioner. And for me, having that wholeness is very important. And I know for a lot of places now, it's like we take God out of the equation. And
Mhm.
when that element is missing, and I don't remember who said this, could have been St. Francis who said, "You're restless until you rest in God." Could have been, but I stand corrected. And I think that that is a key element of creating equitable mental health from a different perspective. Equitable in the sense that when you bring that spiritual balance, and if you maintain that spiritual balance through connecting to the God of your understanding, whether you're a Christian, Hindu, Muslim, Jew, or any other spirit, have any other spiritual practice, once you can bring that into the balance, I think that you would find the wholeness that you're looking for mentally. And I believe that that's where the equity in mental health should start, by finding your spiritual balance. And I'm saying that because of where I stand in terms of your spirituality is basically what's going on in your mind, what your thinking is all about. And I think if you can get it right at that level, then you will see equity in mental health care. People like myself and yourself would look at mental health care from a different perspective, because when a client or patient come to us, we can then help return them to that sense of wholeness without judgment, without saying, well, you've been bad or you've done this bad thing, so this is why this is happening to you. Rather than looking at the problem, we really work deeper to pull the issues out so that persons can identify, okay, this is where my thinking is, this is where I need to get my thinking to be so that I experience that well-being, that mental well-being. And that's my perspective on equity. There are lots of things we can do, but I think at the very core of all things, our mental wellness is linked to spiritual wellness. And if we get that right, then we will be okay. We'll be more than okay.
I'm in agreement with you. I'm in agreement with you. And what I've found in these last few years is that at least in the mental health, in the mental in a healthcare arena, I'm starting to see more of the integrative care, in where it's not just taking care of the body. There's more than just the body. There is the mental, and it's also the emotional, which is can be the spiritual. And if it's not, if you just take care of the body and something else going on mentally or emotionally, the body it's just one little piece of it. And we're getting, at least I'm seeing now in healthcare, that they're trying to touch on that more. Are we there all the way? Absolutely not. There is still work that needs to be done in this area, but we're making some stride.
And it brings us back to the question I posed earlier about encouraging GPs to check for mental health issues, where the body and mind connection can lead to disease. If I'm not feeling well, is the root cause just a physical problem, or is it a psychological problem? And I think this is where, when we talk about mental health and equity, we need to look at it in a holistic way. We're not just thinking of the physical aspect, that mind body connection. We look at the whole, we're no longer just taking an aspect and saying, oh, little Johnny behaved badly today, so let us look and see what's going on with him at a mental level. But we're looking at his emotional and spiritual well-being all in one. And I think for me, that's how I view equity, the wholeness of the person. And how do we get there? How do we get people to that place of wholeness, total wholeness?
How do we get there? Well, I think one thing way that we're going to have to get people there is, again, education with with our medical and our healthcare. And it has gotten better in the sense that we, at least, I mean, I remember there was a time where in medical school, and I remember someone telling me they one class on nutrition, mental illness. I'm sure we need to educate them so that they can ask those persons. Maybe they're suffering from some depression, and the depression is stopping them from taking care of the body. So those probing kind of questions have to start from our healthcare professionals, and I don't want to put it all on them. It's everyone in the healthcare profession needs to ask more of those questions, not just do that superficial surface. They need to probe just a little bit. Yes, maybe that person might not like some of those questions that you're asking them, but in doing those questions, you might be able to find out the real reason why they're feeling a certain sort of way, and be able to direct them in the right resources. A lot of times we're giving them the wrong resources. Take your medicine. Well, I don't want to take my medicine. Or they take the medicine and they still don't feel better. Well, that's because you didn't ask them the right questions.
I agree with you. Asking the right questions can really help you to assist another human being
I can't hear you.
finding them. I said, I agree with you there, that asking the right questions can really help in
Hello?
assisting.
Goodness, I can't hear you.
Asking the right questions can assist in help to find wholeness. That's all right, Cynthia. That's right, okay. Seems as though we're having some technical difficulties again. But Cynthia was just talking about asking the right questions. She spoke on nutrition. And these are all areas in which we can assist our clients and patients in terms of having the right nutrition. When they come to, we ask the right questions so that we can help them to identify the areas that are causing them distress in their life.
I'm so
Cynthia,
sorry.
can
I
you
don't
hear
know
me
what
now?
happened. I can't hear a word you're saying.
Okay. So what I'm going to do is a quick recap of some of the things we discussed earlier. That is families and finding the ways in which you can treat for the whole family, bring the whole family on board for mental wellness, especially if they have someone living in home with them, how that can impact the entire family, way forward everyone gets to that place of safety where they can share and find wholeness collectively. We also discuss having mental health as part of the general curriculum in schools. And we talked about the disparity in economics, where persons the wherewithal to afford the, or should I say, the luxury of affording to go outside of their locations, another location for mental health. Mental health.
Can you hear me?
Yes, I can hear you, Cynthia. I was just doing a recap so that our audience can have that information as to what we were
Can you
discussing,
hear
which
me?
is the behavioral problems being
Yes, I can.
misdiagnosed in some
Okay.
cases.
So the
Discuss
being misdiagnosed in some cases.
Oh, goodness.
So I'm just going to go back over what I was just saying, that mental health equity calls for us to be more open with where we are at as healthcare professionals. There's still a lot of work to be done in terms of getting persons the help that what we here at Mental Health Matters are doing, raising that awareness that mental health matters. There's still many hurdles, as I said, to cross. There's also the situation of ethnical backgrounds, cultural backgrounds, and wanting to have therapists that look like us. And that may stop some of us from going and seeking the help that we need because of where we're located. I know, for example, I have a friend who lives here in Barbados. She's a life coach, and she was invited to Canada to a jurisdiction where they did not have Black therapists to do a few sessions there. And these are some of the challenges that some Black communities face, not having therapists that look like them. But I think coming out of all of this, the major challenge for a lot of people outside of stigma is the finances. Healthcare, whether it is medical or mental health care, comes at a cost. And for a lot of people, especially if you're in the low economic brackets, accessing healthcare, if you have to pay for it, mental health care, sorry, if you have to pay for it, may not be in their budget. And from where I stand, I'm not 100% sure that there are enough free clinics, especially here in Barbados, that you can just walk into privately without being seen by all and sundry. Because I do know that at our polyclinics, we do have psychologists and psychiatrists. But the stigma attached to mental health keeps a lot of people out the doors rather than going in through the doors. Cynthia, are you back with me?
Yes, I couldn't hear you. I mean,
Okay.
yeah, I couldn't hear you. Uh, and there lies our problem, as you were saying. Yet the it, there's not enough free or reduced fee clinics available, and I don't know how to solve that issue. Because again, as I was telling you, many of the therapists that come into our facility, they come in as interns. They do their internship, and then once they get their license, they leave because they know that they can make more money in the private sector. It I like the idea of what you said about the government maybe subsidizing. Maybe that might keep them in the nonprofit for a little while longer. But I don't know what the solution is for that because there's many individuals that do need therapists. They need lean, but it's difficult to find counselors. Their workloads are very heavy, and in the private sector, especially with the insurance, you are going to pay for a certain amount of sessions.
Well, what I would like to say is that we can create a world that works for everyone. But again, it brings us back to finding that place of spiritual connection. And that's what I do when I meet with a client: return you to wholeness, help you find that wholeness. I think that is a key part of getting persons to mental wellness, being aware of who you are at that level of spirituality regardless of your religion, regardless of your ethnical background, your sexual orientation, finding that place wholeness. I think that moving forward, come to safe places where you're not judged and safe places where you can just be free to share. That is important. Should we wait for governments to subsidize mental health care programs? I would say no to that. I would say that when you sign up to take care of another, and we can go back to the Hippocratic Oath.
Hopefully, Sonia will be back in a few. We're having a little difficulty with the connection. She should be back soon.
I'm sorry about that. We're having some technical challenges this morning. And as I was saying, when you sign up to be a healthcare professional in any area of healthcare, I think you have to approach it with compassion for the person that you're dealing with.
Absolutely.
It can't just be about what's in it for me. It has to be what's in it for all of us. And if we as healthcare professionals really want to make a difference, we have to start with ourselves first. How am I showing up? Am I showing up as that person who really wants to help the client to become whole and move on? Or am I showing up as that person who wants to keep the client and have a long list of clients forevermore? As for me, I'm about returning you to wholeness. You come to me with an issue, I would trust that within the first session, that issue is healed and you can move on. And that's because I'm a religious science practitioner. I'm working with the spiritual element. I'm working with wholeness. I don't want to have clients holding my hand or I'm holding your hand forevermore. That restricts me from being able to help more people. And I don't think that finances should prevent a person from having the care that they need. I honestly think that as a mental health care professional, sometimes we need to re-examine what we're really doing when it comes to the financial aspect. There must be other ways in which to buffer any fallout. I cannot be happy. I would not be happy if I'm taking from someone who needs help but cannot afford, and I say, well, go away. I can't help you because you can't afford it. There must be a way around that. But for me, as a spiritual practitioner, I would look at things a little differently. I want to see the whole picture, not just a part of the picture. And that's not to say that I'm going to devalue my worth, but there must be a way to work things out, to bring that balance back, to bring the equity that we're talking about. There must be a way. And as for me, and this was my last question, it's not really a question, but what I wanted to hear from you, Cynthia, is what would an equitable mental health care, what would equitable mental health care look like, and what would it feel like for you?
What it would look and feel like for me is the whole body, the whole body, the whole mind, the whole, many of the things that you were talking about, um, finding that wholeness. I don't want to just my body to feel better. I want my wholeness to feel better. And how did that look me going into to a facility, and that person that's treating me look at me as a whole person and ask themselves, what can they do to help me be that whole person? And it may not be, here's a pill, make you feel better. It might be spiritual connection. It might be, maybe you need to speak to a counselor, to a therapist. But that wholeness, and will we reach it in, we're working towards that, but we have a lot more to do. It's still a work in progress.
It is. It is. Well, I would say for me that equity in healthcare looks like one word, and that word is love.
Yes,
And coming out of that word, it is self care, not just for the person you're caring for, but for yourself as well.
absolutely.
But overall, I'm in agreement with you. It is about finding wholeness in the finances, finding wholeness in the physical care, the mental care, emotional care, and my favorite part, spiritual care, finding wholeness in those areas. That brings us basically to the end of our program this morning. Cynthia, I would like to thank you for joining us. And I
I
would
want to
like to thank all those persons out there on the World Wide Web who joined us for tuning in.
thank you for
Are there
having
any
me.
last words, Cynthia? Thank you too.
No, no. As I say, thank you for having me. And this is far